share with you what is Crohn disease. In fact, there are quite a lot of patients, they are facing this type of bowel disease and they could not find any solution. What is Crohn disease? Crohn disease is also known as regional enteritis, which is a type of inflammatory bowel disease. And that can affect from mouth to anus. So therefore, it can cause a wide variety of symptoms. It depends on which part of the gastrointestinal tract is being affected. Now, the exact cause of the Crohn disease is unknown, and some researchers will say it's a genetic disease, and of course most of the doctors will say that this is caused by autoimmune problems. What are the signs and symptoms? The symptoms depend on what part of the intestinal region is affected. Patient can have abdominal pain, may have vomiting, diarrhea, even stools with blood and so on. So what is the treatment for this type of cases? And doctor, most of the time, they will give anti-inflammatory like medication like aspirin to reduce the inflammation, and certain patients being given antibiotics and other things like immune system suppressor like steroid drugs and all that. So in fact, all these medications is only for symptomatic treatment. But in long term, if the patients go on with all these medications, they will suffer from a lot of side effects. Now, my opinion, how to solve Crohn disease? We know that when your immune system is out of balance, they are unable to recognize yourself. In Crohn disease, the immune system attack your intestinal lining, and we can balance back the immune system to stop the immune system from further attacking and destroying your intestinal tract. Then at the same time, you use nutrients to heal back the damaged ulcers or whatever linings in the intestines, and in long term we maintain a good balanced immune systems so that your immune system will not attack your gastrointestinal lining. And I feel this is the only solution for Crohn disease. What I will give Crohn disease patients with DSM products, the best products that to balance the immune system. At the same time you balance the immune system, you heal the gastrointestinal linings. So these two goes concurrently, then the patient's ulcer or whatever fistula at the damaged region, it will heal. And later on will prevent the immune system from attacking again. So that is the root solution to Crohn disease. So GL powder is the best. So what you can do, the GL powder, which is one bottle is 30 grams, you can mix 10 grams of the GL powder, shake it up with about 300 ml water, and you just take it, split into 3 times a day. Okay, then you can take spirulina. You don't forget spirulina, because most of the Crohn disease patients, they have poor absorption of nutrients. At the same time, due to the bleeding, they could be anemic. So spirulina is the best product to replace all the essential nutrients for the body. So they can take 10 tablets 2 times a day, right? At the same time, don't forget your lineman. Lineman is the best product to repair any intestinal problems. So at this stage, when the patient is in acute stage, you can take 10 tablets 3 times a day, right? And at the same time, you can give some anti-inflammation products like cotipine and morinzyme. You can start with 5 ml of cotipine with 10 ml of morinzyme. So for the first week, you can take once daily. mix it with 1 glass of water once daily and for 1 week. And the second week, if you find that the patient is improving, then you will take 2 times and then follow by 3 times. So why I start Codipine and Morinzyme at a slow phase? Because Codipine is an anti-inflammatory product plus Morinzyme when it also heals the site of the lesions. When the healing takes place, the patient can have symptoms. The patient may have blood in the stool again, and she can be frightened. So you have to reassure the patient that this is the healing effects. Okay, so start with small dose, 5 ml Codipine with 10 ml Morinzyme, once a day for 1 week. Later on, 2 times, and followed by 3 times. And in long term, so when the patient recovered completely from symptoms, free from symptoms, so you can reduce the dosage. In long term, it has to be taken as a healthy supplement to maintain good immune system and prevent relapse of Crohn's disease.